Hi everyone, welcome back. My name is Amanda Gold, and today we're joined by Jeff McNally, Senior Medical Director for Home Care, Hospice, and Palliative Care here at Intermountain Healthcare. We're going to be talking a little bit about advanced care planning, what that means for you, the community, and how you can help your loved ones during this time. Jeff, thank you so much for joining us. We really appreciate it.
Thank you for having me.
So I want to start out with talking about your role. How is your role involved with advanced care planning, and what do you do on a day-to-day basis as well?
Well, so as you mentioned, I'm the Senior Medical Director for our Intermountain's Home Care, Hospice, and Palliative Care Services. And the system strategy for advanced care planning was put under palliative care a couple of years ago. And so we started working on that under the umbrella of palliative care. And so a lot of my work with palliative care and advanced care planning has been developing a steering committee from within the system of leaders to help us support this work. And so really on a week-to-week, day-to-day basis for the past few months with advanced care planning, that's been most of that work, interacting with other leaders and system people.
Has anything changed with your role as far as the pandemic? Was this work shifted quicker because of it, or did it have any impact on what you're doing right now?
Yeah, that's a great question. So we were about to do our big system launch, the first of this year. We had just had our first steering committee meeting, started some work groups. We're ready to launch kind of a wave one work, and then COVID came along, and it did kind of put things on pause for a bit. But it's interesting because about a month or so into COVID, as we were seeing what was happening in other parts of the country and the world, it was recognized that palliative care and advanced care planning was very important to the work that was happening there. So it's kind of reshifted back to us. We went from being in kind of pause mode to really hurry up fast mode, which was actually very exciting because we got a lot of support from the system to put some things together recently that'll be really great for our community and for our providers.
Do you want to talk too about what advanced care planning is if people don't know what that is, and also why is it so important for people to be aware of that as well?
Yeah. It's a great question because honestly, even as a physician for 25 years practicing medicine, I didn't really completely understand what advanced care planning meant. I think a lot of us think as advanced care planning as, well, I guess that means I need to sign some kind of document or check some boxes and sign a document. But advanced care planning is the actual process of communicating or communication between a person and their healthcare team. So by healthcare team, I mean your doctor, your nurse practitioner, your PA, maybe your nurse, the medical assistant, social worker. There could be several people involved in this, but it's a very deliberate process of communicating with you to understand what's important to you, to make sure you understand your illness, if that's something you're dealing with at that time, and what your options are for care, so that when you fill out a document around that, you understand what it means and you're involved in that decision making, and it's not just sort of a check a box so that something can be put in your record. And it's important to be aware of that because one of the goals we have with our new implementation of these processes for advanced care planning in Intermountain is that we want to be responsible for initiating that conversation. So we're hoping that when people in the community are given that opportunity to talk about advanced care planning, they don't think of it as just, I need to check a box and sign a piece of paper, but recognize it as an opportunity to really be engaged in their own health care and to talk about things that are important to them.
And what are some of the primary documents that are actually being used for advanced care planning? What should people expect?
Yeah, it's simple, but it's confusing because there's a lot of terminology that's used differently. But really, there are two primary documents for all of us to be aware of, and one is the advanced directive, and that is the document where you can choose someone to represent you in case you're unable to represent yourself. If you become in a certain state of health where you can't express your wishes, you can designate someone to do that for you. And then it gives you a chance to express your wishes. And this is the part where it can be just check a box and put a name on there, which historically, unfortunately, is very common throughout the country. But what we're looking to implement here is having real meaningful conversation that doesn't just happen over a 5 or 10 minute conversation during an appointment, but may happen over time, where we understand what's important to you, make sure you understand what your illness means to you, and really even go through specific scenarios. If this were to happen, here are some choices you might have. What would you want to choose? Then that's all in that document, so that's a meaningful document, so that if something were to happen where a physician had to pull that up and look at it, they would really understand what was important to you and be able to follow your wishes. And the second document is what's called a POLST, a physician order for life-sustaining treatment, and that is a a portable document that you can keep in your home in case something happens to where paramedics arrive in your home, and we want to be sure that they know what your wishes are. And that's a similar document, but it does require a physician order or a physician's signature on there to be legal and meaningful.
Okay. So when should we actually start thinking about creating these documents for ourselves? And also, is there a point where you create one for a loved one if they're not able to as well?
Yeah. So that's a great question too. And really, the answer is now. We should be thinking about these now. And the program we're using is called Respecting Choices, and it's a company we partner with out of Wisconsin. And they have a great processes for implementing this in a community and in the healthcare system. And it starts when you're young and healthy. And, doesn't feel intuitive and natural necessarily to talk about difficult health issues or even death or being in a difficult, state of health where you need to talk about these things. But it's turns out that when people do this, even when they're healthy and young, and they talk about decisions they would want made and who can make them for them, it's very comforting, and they feel much more control of their own lives and their destiny. So even if you're young and healthy, even if you have an advance directive, we would ask you to think about it now. So if you don't have an advance directive, we can talk more about how to reach out to get that done. But if you do have an advance directive, think about, is it meaningful? I mean, you're the one that filled that out. Does it really express your wishes? And if it doesn't, then we'll talk about how we can, get you access to somebody that can go through it again. So it's not just a very close to end of life process. It's something that we need to think about when we're young and healthy, and then as our health care changes and our health status changes, it needs to be updated, and our wishes change, our health status changes. So it's an ongoing process throughout our lives that we should be thinking about.
You answered one of my questions about if it can be changed or not, which it sounds like it can.
Yeah.
So I know that Intermountain is creating a new advanced care planning process. Will you describe what that process is and the tools that you guys are implementing and how that will impact the community as well?
Yeah. So for the healthcare providers, probably the most important tool that we are implementing, and this will be as of July 9th, is in our electronic medical record. And this, again, is very common in healthcare systems across the country. We currently don't have a very good way to store advanced care planning documents. They're in the medical record, but they're not easy to get to. And discussions around advanced care planning that are in patients' notes are not easy to get to either or find. It takes a lot of work to get to it. And so we are creating what we're calling an advanced care planning dashboard, where it's a one-page, easy access to get to any advanced care planning documents that are already in the record, any notes and discussions that have been had around advanced care planning that are updated, the easy access to those. We can create and print advanced care planning documents with this dashboard. So the impact this will have on the community is that kind of the reassurance that if you go through the effort to talk with your healthcare team and make an advanced directive, you can know that that's going to be stored in a place in your record that when that's needed by somebody, they can find it and they can honor your wishes. And that's really been a powerful thing for other communities that have implemented this Respecting Choices process over the years. That's probably the biggest thing. And then the second thing is just being engaged in your own health care. I mean, my opinion is over the past several decades, we've made incredible advancements in healthcare with technology and pharmaceuticals. But I think along the way, we've really lost that connection with our patients in some way, and really including them in making decisions about their care, understanding their health status, and that they have options and what those mean. We've kind of lost that a lot over the past few decades. And this is an opportunity for patients and their families to be more engaged in their own health care and have more control over that.
Has this advanced care practice, has it come up a little bit more with COVID? Has there been situations that people have run into where they don't have these documents created yet, and it's then up to the family members to decide what happens? What's the process like with that? I guess it's probably very important because something like this is currently happening, but if someone doesn't have these documents already created, what kind of happes with their family members, or who makes decisions?
Well, that's a great question. And, fortunately, as you know, in Utah, we were able to flatten the curve and not hit a crisis stage like like they experience in other parts of the country, especially in New York. And as many people know, we had teams from Intermountain go to New York, and part of what they reported was we need to get this figured out in our system because they are seeing patients there in the hospital that don't have advanced directives, what their wishes aren't known, their families don't know. It's extremely stressful for the family members. Really, that's kind of ultimately the end there, is that it's very traumatic for them to have to make some decisions not knowing what their loved one may have wanted, and same thing with the caregivers in the hospitals. And so because we've flattened the curve, we've had a little more time to kind of get a real good foundation on this work. And what we're trying to do is start a little further upstream with this work and not just try and get it done when someone lands in the hospital. So we're really trying to work through our primary care clinics to get the information out around this work to their patients so that we can have these conversations in the community. So if someone does end up in the hospital from COVID or whatever else, that we're more prepared as a system to meet their needs and respect their wishes.
So who should someone talk to if they are interested in advanced care planning and planning for the future? How do you get this started for your family member or yourself?
Yeah, that's a great question too. So you should be able to reach out to your provider. We are working with our clinics through our advanced care planning strategy to have the educational materials they need to start that conversation and the training they need as well. So that would definitely be the first place to start. And our webpage, intermountain.org, and there's a advanced care planning webpage on there that has resources, educational materials people can print out, and also some phone numbers and emails to reach out to other resources in our system.
That's really great to know that that resource actually exists, and you said they're putting education on there as well. Is there anything else that you want to mention to us about advanced care planning, why it's so important, and why it shouldn't be something that's waited to be done until the last minute?
Yeah, I think I just want to emphasize again the emotional part to it, and really just, I guess I ask people to maybe feel uncomfortable about having these conversations. That two things about that. One is that experience has shown that when people spend the time to do this, that they feel relief and empowered about their own health care and their own lives. But really, it's going to provide relief for your family and loved ones when the time comes to make those kind of decisions, because there won't be uncertainty about it and anxiety about it. So those are the two big things.
Well, Jeff, thank you so much for joining us. We really appreciate the time, and I'm excited to see what Intermountain does with this in the future. And like Jeff mentioned, there are a couple of places where you can get information about advanced care planning. You can visit the website at intermountainhealthcare.org/health-information/advanced-directive, and we'll put that link in the bio for you guys to look at as well. We also still have our COVID-19 hotline available that you can call to get screened or tested. That phone number is 844-442-5224. We also have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.